Have you ever wondered what your therapist is really thinking during your sessions? Well, stay tuned because today we're gonna dive right into the mind of a therapist, which is me. You might be surprised at what you find. If you're new here, thank you for stopping by. My name is Venus and I'm a music therapist based in Sydney. On this channel, I share evidence-based research and tools and experiments that I conducted on myself and also on my clients that hopefully will inspire you to improve your well-being and life satisfaction. Therapy can often feel like a one-sided conversation. You spill your deepest, darkest thoughts and feelings and then your therapist just, nod and listen. But what's going on behind that thoughtful nod? Today, we are lifting the curtain. Let's first talk about judgment. Do we judge? Of course not. We are trained professionals who understand that everyone has their own struggle and unique life experiences. And we are here to help our clients navigate these challenges, not to pass judgment. And this applies to both within and outside music. It's just sometimes only when we think out loud we realize how ridiculous or nonsense our thoughts are, and then we judge ourselves already. And then we might think that our therapist might be thinking the same. And that's not the case. But we're here to solve the problem. We want to get to the root of why you're thinking like that and how to rewire these thought patterns. That's why, no judgments here. But in my world, sometimes my clients honestly are just making noise with their instrument instead of making music. I'm not telling you this because I'm judging them from a musician's point of view, but a lot of clients, they have special needs and they have different complex diagnoses. That means they are actually seeking a lot of sensory input from the instruments that they're playing. For example, they like the auditory feedback or the texture of certain instruments. For example, this evil bell. When they engage in repetitive behaviors of constantly shaking the bell or just tapping on it, it's really noisy, and sometimes, not gonna lie, I do need to wear earplugs at work to protect my ears. For real. Yes, this is just part of the job. I'm not judging them, but I feel for them. They need to do this in order to feel better physically, and then they will calm themselves, and then they can continue to engage in music, which is very weird, but that helps. Next, let's talk about sharing. Your therapist can't read your mind. They can only help you based on what you tell or show them. I think music somehow can be the easier or harder medium to share our feelings and express ourselves. Some people find it easier to convey emotions without words when they're playing music or singing a song. But others might feel shy when they're being asked to play music. If you want to change your way of thinking, improve your well-being via some sort of therapy, you need to be honest with yourself first. If you hide things or lie, you are not only lying to your therapist, but first to yourself. And what's the whole point of going to therapy? So, pick your poison. We live in a world nowadays full of options. So go explore what kind of therapy would facilitate your self-expression the most. That will help you share in a very transparent and effortless way. And please, during the sessions, try to be as honest as possible. Remember, therapy is a place when you can be really honest. No judgment, as we mentioned in the first point. Next, a lot of you might be thinking, does your therapist really remember you? Of course we do. Every client is unique. We might see many clients, but we are trained to remember the details and conversations that you share. In my case, all your behaviors, all the music that you made are safely logged in my clinical notes. Of course I remember. We are pretty invested in your journey. I remember literally everyone, even the patients that I met only once in the hospital. I know that every time I met someone there, it might be the first and only time we get to make music. That's why I treated it like the last. And this also helped me to not take anything granted in life. Yes, I not only remember my clients, but I also learn a lot from them, so thank you. And I get asked a lot whether therapists pick their favorites. How do I answer this directly? Simply no, but to be honest, some clients are more pleasant to work with comparing to other. Maybe they have high support needs and I might need more help from the carers or support workers. But in general, no, I would say, yeah. I still love my job, don't get me wrong. It's just sometimes it's tough and it really challenges my physical limit. For example, I have to sing really loud on top of those instruments, or my fingers will literally hurt from playing guitar with a client because they have no idea how much force they're using when they're strumming the guitar opposite to me. Yeah, that's just part of the job, but yes, some are more pleasant to work with than the others, but I don't pick favorites. Final words. Your therapist is not trying to fix you. We're here to guide and support you as you try to understand yourself better via learning new techniques or unlearning past behaviors. Therapy is not about quick fixes. It's all about growth and self-discovery. We truly care about you. Yes, we might not be friends in the usual way, but we really want what's best for you. We are rooting for you when you make progress, and we're here to help when things get hard. So this is a quick look at what your therapist is really thinking during the sessions. Do you want to know more about music therapy? Check out this video here for a Music Therapy 101 quick guide. And remember, therapy is a very personal journey. It's all about finding what works for you. Don't be afraid to explore, ask questions, share your thoughts, and be an active participant in the session. Thank you for tuning in, and I will see you in the next video.